As a medical student, I was fascinated by the presentation of individuals that had mental illness because it actually defied the traditional way of looking at diseases, and there was at the same time an incomprehension of what we were observing. And that challenge to understand what was happening in the brain of someone that had an hallucination when they were seeing something that was not there scientifically was very interesting. But at a personal level, it was very distressing to me as a physician not to be able to help those that were suffering. And I was also very enraged by the lack of attention of the medical system towards patients with mental illness. So I think that I had this confluence on the one hand, seeing the unfairness by which individuals with mental illness were addressed, or more properly say, not addressed, while at the same time the enormous challenge of trying to understand really what was happening in the brain of in mental illness. I think that if we work as individual groups, we will find behind. I think we would be in the Middle Ages. I think that clearly our ability as humans to transform is based in our capacity to organize and integrate in communities, and history speaks for itself. So the way that we're going to be able to address the problem and the treatment and prevention of mental illness is by nature the integration of efforts from multiple communities. Is not one individual that will solve it. I think that's magical thinking. I guess that there are multiple levels, and I would say, yes, there are policy changes, but there's also a change in the landscape, and one of them is the recognition that mental illness are diseases that should be treated and that we should not be ignored. And to me, one of the, and again, in trying to simplify it, one of the aspects that is a gigantic barrier is the stigma. And stigma always exists, it's facilitated by the lack of knowledge. And unfortunately, in mental illness, in part too, because it's addressing the brain, which is the most complex organ, our knowledge is much more limited. So the first thing that I like to be able is to prioritize the importance of understanding what are the changes that happen, why is it that we have mental illness, where's that disruption, to understand it better. Policy-wise, I think that the recognition that not treating mental illness actually adversely affects our economics and the health of the individuals and those that are surrounding them as a priority, such that you cannot find reasons of why you are not going to provide treatment with someone with mental illness, or why you cannot find reasons of providing suboptimal treatment. Why is it that we don't demand evidence based on the treatments that are provided to those with mental illness? To me, that's something that is extremely important to address. There's not one thing that gets rid of the stigma, otherwise we would have got rid of the stigma. Certainly knowledge. I remember when I was growing up in Mexico, I was a little girl, and they were speaking about this woman having cancer, and it was sort of nobody wanted the other person. It was stigmatized. Cancer was stigmatized. And the stigma came around because people didn't know what it was. They were afraid that they'll get cancer by interacting with people. So anything that we don't know creates that sense of stigma. Another aspect of it in terms of the stigma is that the families themselves become silent and they don't speak up. And as a result of that, someone that may have in their family or then themselves a mental illness don't recognize how prevalent it is. So one of the things that I speak up in terms of this one, because it's the same substance abuse, which is a mental illness, people have to start to speak up and not feel threatened of the consequences they when speak up. And once that dialogue is open, to me that's one of the most important barriers that will bring down stigma. When the person themselves, because we're incorporating that silence, and by incorporating it, we accept the stigma. We've ashamed of the disease. We're not willing to speak up because we're afraid something will happen. If we can break that and yet at the same time provide those individuals that are speaking up an environment where they can do it with no negative consequences, that would be, I think, a very important first step towards getting rid of stigma once and for all.